In the 29 years that PAMIS has been working with people with a profound learning and multiple disabilities and their family carers, this last 18 months has been some of the most challenging. The inequalities faced by this group have always been there, but COVID-19 provided a spotlight on this reality. Throughout the pandemic, we heard firsthand about the impact: abandoned, forgotten, lives not valued. Families felt their children, young people and adults with a profound learning and multiple disabilities were invisible to many of the decision makers and within their own communities.
Obviously we knew that there was a possibility of a lockdown, but had no idea what that would actually involve or what the impact would be. But from one day to the next, the support and the care that we'd had for our son just stopped, vanished. Previously, Neil had had quite a high level of support because of the level of his needs.
Yeah, absolutely.
He had been in supported accommodation with full-time care, then had a long spell in hospital and came back home to us to recuperate from all of that. And within 6 months of that, we were into lockdown. The main thing was making sure that Neil's health was protected. So when the carers stopped being able to provide support for that 3 weeks, we thought that's the best thing. But then as that continued into 3 months and then nearly 6 months, it just became very, very hard to sustain. I think the word that sums it up is we felt abandoned. We heard nothing. When we did ask questions, nobody could give us any answers. I think the worst point for me was when I expressed my fears and anxieties about what would happen if either my husband or myself became unwell and unable to look after Neil. And the response I got was, well, all we could offer was admission to a care home. So that for me just felt devastating. And that kind of anxiety has remained, I think.
Yeah.
One of the big things for us was how do we actually keep our son interested and involved? And we were trying to build up strength for him, and his health was, he'd become very weakened, so we were trying to kind of help him to progress. So things like finding places that we could go outside, and the fact that the weather was beautiful helped for nice walks and things, and that helped my mood. The downside of that was that it was very, very restricted where we could go with a wheelchair. And the other thing that has been a really inspiring thing has actually been the way we've been able to access activities online on Zoom and YouTube as well, where some organisations have really risen to the situation and provided things that were appropriate for our particular situation, for our son to be able to feel part of things. There still remains for me a sense of concern and anxiety because the vulnerability hasn't really gone away. We haven't reintroduced Neil to any of the actual out-of-house day services that he had previously gone to. We have continually had to try to risk assess every situation and every possibility. And that's been quite hard as well, because you've got to risk assess the physical risks of exposure to virus or whatever, but you've also got to assess the whole mental health issues for Neil, but also for ourselves.
Absolutely.
What I'm left with, though, is very much the sense of the emotional impact as well for ourselves, and feeling just very, very fragile about everything now going, looking ahead. I think that's one of the hard things actually for us as a family, is being able to think about the future. We've felt we've lost any sense of being able to trust or have confidence that any organisational support will actually be around or won't be withdrawn. So it's that sense of being on very thin ice.
We knew that due to the complex comorbidities of this group, many with 2 or 3 of the high-risk conditions, a high proportion of this group should have had shielding letters. Many didn't receive these and had to fight to get support. For many, there was no PPE, a withdrawal of allied health profession services, no day service, no support services, guidance that ignored the needs of this group, public health that didn't support the required risk assessments of the emotional and mental trauma of not having loved ones visiting. The marked deterioration in physical and mental well-being, with many individuals losing skills that may never be regained. Family carers are exhausted, many still with limited support, and some have been forced into giving up the care of their relative, or worse, considered suicide pacts. This is the backdrop in which this COVID-19 research was carried out. PAMIS were able to engage a large number of family carers in this research, who obviously saw it as absolutely vital in order to highlight the inequalities and issues that they were facing.
I suppose in the first instance was that my daughter has a 5-day service with her provider, so we were told initially that things were going to reduce, and then as the days and the hours changed, that was changing rapidly, and then it was basically no service. The whole lot of the service was to be closed. It was a bit of a shock from 5 days to 2 days to no days. The main sort of contact I had was through PAMIS. My daughter did the online music sessions and stuff.
Yes.
She really enjoyed them, and she was really clued into the group that she was actually working with. So it was a different theme each week, and she would look forward to what the theme was going to be, and it really kind of kept her interest. And then myself, I did the carers evening. The times that I was able to join, I did feel that everybody was really nice, and everybody was sharing their experiences, and I think that was quite good as well, because you did feel isolated and all alone, that you just kind of thought, other people are sharing the same things as yourself, and maybe things that they had overcome. So it was actually quite interesting to kind of listen to other people and kind of share those things, and obviously it was quite good that people were open to sharing them, because obviously it's a very kind of private experience for everybody, because everybody's situation is unique. At home, things were changing for my daughter, for her health, so I was quite anxious to find out how things were going to progress for us. Whenever I've asked questions about why we're not coming back, then we're just kind of put across about the factors that have to be put in place by Health Protection Scotland. She's been back 1 day, but things repeatedly keep changing for her, because the newness of the staff and how our conditions changed during COVID. So it's obviously having to try and it would be better if it was the more experienced staff for me, to enable her to get the best of her days. The days that she's there, it would be better if it was more experienced staff. But I suppose that's just the way that social care is at the minute. I just kind of think that when we were back in August and somebody was delivering a parcel to me, and they kind of said, the 9th of August, what does that mean for you? As if this was this big day, then all of a sudden things were going to get all better. And I said, well, really things aren't going to change for us, because until my daughter's services are up and running and we're back to pre-COVID, then things aren't going to change. But to be honest, the way things seem today, I don't really think that's going to be in any time soon.
Profound means deep, means wise, it means expert. And we know that this group of people and their family carers are able to teach the rest of us how to get it right. Our families are experts in infection control, in remaining calm and providing care in crisis, in considering sensible and ethical solutions to difficult dilemmas, and supporting everyone to work together. Our hope is that this research raises the visibility of this group of people so that they're not abandoned with any future pandemic, and so we can address the current issues of lack of services and day services. And in the future, and during any other pandemic or crisis, this group and their families are involved as partners at a national and local level in developing appropriate policies, guidance and solutions. That they are partners in any decisions that are made, and therefore become visible.